Wastewater treatment from medical facilities. Hospitals help to keep people healthy, but they need constant support for their activities. In this video, we will talk about an area that is not always given due attention. It is a sensitive medical issue with moral standards of wastewater treatment in medical institutions, which is why the legislative framework in most countries is not fully developed and there is no culture of hospital wastewater management. Hospitals are places with an increase in pathogenic microorganisms. Therefore, their wastewater must be additionally treated and disinfected before being discharged into the municipal sewage system. GlobeCore specialists have developed a technology for treating wastewater from infectious disease hospitals, including specialized tuberculosis hospitals and others. This technology is implemented by an autonomous complex with AVS devices. AVS uses a rotating electromagnetic field that creates conditions for rapid mixing of wastewater with reagents and simultaneously deforms the biofields of pathogenic microorganisms, after which they die. The complex treats and disinfects both liquid wastewater and wastewater containing solid fractions. Let's look at the technological scheme of liquid wastewater. Liquid flush from the storage tank enters the AVS apparatus, while disinfectants are supplied to the AVS from the reagent tank using a dosing pump. In the working area of the AVS device, the wastewater is mixed with disinfectant, and pathogenic microorganisms are destroyed. The disinfection is carried out in the flow. After analyzing the samples, the water is discharged into the sewer. If there is a solid fraction in the wastewater, a mill is installed in front of the AVS devices to grind solid biological waste. If necessary, it mixes the resulting product with water to obtain a liquid mass with a viscosity of no more than 1 Pascal-second. The rest of the process is similar to liquid wastewater treatment and disinfection. Thus, the GlobeCore technology eliminates the possibility of discharging infected wastewater into the municipal sewage system. The proposed complex is autonomous, can be quickly installed at the place of operation, and immediately starts wastewater treatment and disinfection. What do you think about hospital wastewater treatment and the technology presented? Please share your opinion and leave your questions in the comments.